A single brain abscess from a temporal or a frontal lobe usually comes from ear, nose, and throat infections. And so you should think otitis media from the mastoid of the temporal lobe or frontal sinusitis for the frontal lobe. And so these infections will just drill their way in, forming ring-enhancing pockets of pus that mimic tumors, but they scream bacterial invasion. So 5-year-old boy has fever, vomiting, and new onset seizures. His parents say that he's got facial pain and nasal congestion. Which structure most likely served the route of the infection? It's going to be a frontal sinus. So why is it not the maxillary sinus, for instance? That's not adjacent to the frontal lobe or the brain. It mainly leads to your orbital cellulitis. What about mastoid that drains to the temporal lobe, not the frontal? Ethmoid can contribute, but the frontal is more directly connected. Cavernous sinus, so that's going to be associated with ophthalmoplegia and not going to be a direct brain abscess formation. So here are the key features. Temporal lobe, febrile, seizing child, comes from otitis media spreading through the mastoid air cells. So temporal, mastoid, otitis media, mastoid, temporal. Ring-enhancing lesions makes you think of an abscess. Beard and strep and aureus are the cause of the bugs. Seizures, lethargy, and fever. Consider CNS complications of ear, nose, and throat infections. If you found this helpful, like and subscribe. We'll see you in the next video.